You are listening to Pharmacy IT and Me, your informatics pharmacist podcast. Hey everyone, this is Tony Dao, and today is Friday, July 5th, 2019, and welcome to another episode of Last Week in Health IT. As with every episode, we start off this one stating that the intended audience for this episode is everybody. Hope everyone in the US had a great July 4th, and since it was a holiday this week, there wasn't much going on in the news side of things, so let's get right into it. So OBGYN health system Advantia Health acquires Pacify, a telemedicine perinatal specialist company. Advantia Health is a health system that focuses on women's health, expanding on convenience and accessibility. They have great features for patients like direct text messaging for booking an appointment or staying in touch with providers. They also have a well-connected network where referrals are locally available for patients for improved convenience. Pacify is a company that focuses on providing low-cost, quality healthcare services to new and expecting parents, focusing on relieving their anxieties and keeping them and their children healthier. They commit to 5 key values: clinical excellence, empathy, health equity, innovation, and teamwork. So Advantia announced that they are going to be acquiring Pacify in an effort to use their telemedicine technologies to improve OBGYN care delivery to patients. Since Advantia has a big focus on convenience and technology usage, this merger seems like a no-brainer. It's cool to see that Advantia knows exactly what its goals are and how Pacify is already meeting it with its patients, and with the acquirement, it'd be cool to see how far Advantia and Pacify will expand their services. So the next news item is Medtronic insulin pump security gets an FDA alert. So coming off the heels of the security issue that Alaris pumps had recently, the FDA has now issued another security alert, referring to Medtronic insulin pumps. So just a reminder, the Alaris pumps had a security issue where firmware updates to its devices were not password protected. So anyone with malicious intent can remotely install a custom firmware update that allows hackers to control the pumps and change medication rates for nefarious purposes. And the FDA warning on the Medtronic insulin pumps are also related to security. This alert refers to older MiniMed devices that have been recalled by Medtronic, and it's been stated that these pumps can be hacked and remotely controlled. Specifically, the Medtronic MiniMed 508 and MiniMed Paradigm series are affected, and as many as 4,000 patients have been identified as being vulnerable to this issue. The alert wasn't specific in what the vulnerability is, but they found that there's been holes in the security that allow people who are nearby the pump to have the ability to wirelessly connect to it and potentially change rates and cause patient harm. So the next news item is Google and University of Chicago were named in a suit charging misuse of patient data. So let's back up a little bit and talk about what happened. It seems to be odd that such a big misuse happened, but it did. And University of Chicago had stated to patients who were being admitted that they would not share information with third parties for commercial purposes. But what ended up happening was UChicago actually did turn over PHI to Google for its own commercial gain. And what's even worse is that they did not notify the patients or get their consent before doing so. So UChicago and Google claimed that the information that was shared was de-identified, but there was still a lot of timestamps and free text notes that was attached to that information. So the suit claims that Google's advanced AI capabilities and data mining skills would have been able to figure out the identities of the patients if they really wanted to. So though it might seem like a stretch, this basically shows what kind of world we're moving towards in terms of data integrity and confidentiality. And Google has been ordered to delete all the patient records they received from the university, and the suit calls for UChicago to comply with the identification regulations that HIPAA requires. So the next news item is the VA and Verizon offer telehealth access to veterans. So now that we got through those two downer stories, let's end the news with something good. The VA and Verizon are working together and offering a new telehealth solution for its veterans. As you know, Verizon is one of the top telecom companies in active business in the US, and they are working with the VA by allowing secure encrypted sessions throughout their 4G LTE network for telehealth. The telehealth service allows veterans to participate in video appointments or visit their doctor virtually with a built-in chat function, and Verizon isn't going to be incurring data charges on those patients. The offering is called VA Video Connect, and is currently available through Apple's App Store, and is currently sitting at 149 on the App Store with 58 reviews. So it's still in the early stages, and we'll see how it goes, but I would say it's a major win for patients to have this capability being backed by Verizon, and a huge VA network. So before we go, if you'd like to hear more news on healthcare IT, you can check out great curated articles at healthcareitnews.com. It's actually where I go for daily healthcare IT news to keep myself updated on what's going on in that world. Alright, if you guys like this episode, you can subscribe and rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme, or on Instagram at PharmacyInformatics, or by emailing me at tony@pharmacyitme.com. And I also wanted to plug a great networking opportunity called Pharmacist Connect. If you are familiar with Microsoft Teams or Slack Workspace, think of Pharmacist Connect as a large vetted one through Slack Workspaces. I've met some great colleagues on it, and there's even an informatics space within it as well. You can find out more by visiting pharmacistconnect.com, which is PharmacistConnect.com. Thank you again for listening, and I'll see you on the next episode of Pharmacy ITme. And remember, technology is a tool, patient care is the goal.